com o tema Declaração de São Paulo, Guidelines da World Federation of Ozone Therapy. Please, Dr. Lamberto.
Thank you. Thank you all. Just 1 year ago, I remember, I don't know if we were here or another place, and we promised for all you some document that could be helpful just to give to you some guidelines that really the World Federation is a big federation with a lot of countries inside this federation, but we don't have a guidelines that can help the people on the protocol, on the best protocol, and on the information that we need for the best treatment with medical ozone. That could be the same all over the world. So that means that with this document, other than be a guideline for you, and I show you now the main topics because really it's a very big document. I can't tell you, show you all the document because we need 1 hour. I have only 20 minutes, but the main topics inside, I would like to show you. So this is Sao Paolo document. It is the new declaration. Sometimes during my meeting or with the colleagues that come in Italy, they told me, Lamberto, I have only one document that I can check. Now there are another document, another guidelines that we create with the cooperation of with Angeles Erario e Walter Travagli and il nostro presidente, other authors. So sometimes I speak Spanish. Bueno, so we can go on now. And this will be a good clinical practice in medical ozone treatment guidelines in medicine. So give a look also to this new way of speak about ozone, medical ozone treatment. And okay, in accordance with the statute, with the bylaws of our association, the World Federation, the assignment of surveying, organizing, and supporting all ozone professionals around the world, World Federation proposed this official document. It must be understood as an international consultative reference. So does not mean that you need to follow this strictly. So every patient that comes in your clinic must be treated differently respect another one. So you need to talk with him. You need to explain the beautiful of this kind of treatment because they come to your clinic with an hope, a big hope. So you need to explain, to talk with them and to explain the response that we can have will be different from another one. Don't worry, be happy. Your beautiful results will come. So it is very important that we use this information to give to our. So some point that I put inside this document is that treatment based on medical ozone include those techniques which are based on the administration of the ozone molecule in its unique chemical formulation derived from an electric or UV excitation of the oxygen molecule through various routes. It is clear. So if you want to treat patients or people with ozone, we need to give ozone. No different molecule. All other techniques that involve the manipulation or modification of the ozone molecules after its production and before its administration cannot, for obvious reason, not forbidden, sure, not forbidden. Must be clear. We are open to every kind of treatment. But if you want to treat one person with ozone, we can't lie. You have to give ozone. Otherwise, if you give another molecule, another modification of the molecule, you can change the name of this kind of treatment. The reasons are not only linked to the lack of adequate scientific literature. Yesterday or this morning, I heard some people telling about the use of the ozone, blood ozonation that we do. We have 30 or 40 years of clinical treatment. 40 years. And we arrived now just to understand how could be possible that we can have this kind of results. So if we want to use different technique, modifying the ozone molecule, we need the same time, I suppose. And another way to understand eventually why we could have beautiful results. So, another point, it is worth remember that the oxygen molecules simply represent the transporter of the main ingredient. This is the reason why I saw that most of the problem that we have with our colleagues, medical doctors, they are engaged in other disciplines, neurologists, oncologists. They never heard about ozone. So we must be clear when we try to approach these colleagues, because they want clear information. And this is very important. If you tell them oxygen ozone therapy, does mean that you give oxygen like something that can help healing tissues. I never saw oxygen given to one patient by vein. The oxygen is breath. The only organ that we have by physiological point of view is the lung. So oxygen is only the passive carrier because ozone comes from oxygen. But the amount is so small, you can imagine. I don't know if we have a syringe that can contain 10 micrograms of ozone. So we need to dilute ozone in oxygen, like we put aspirin in water. You never heard aspirin, water aspirin therapy? No? So we need to think about this. This is the problem that we have now to reach other colleagues. So I don't like to say is these people don't want to talk about ozone. Okay, there is some people that usually they don't want. But if we are so clever to explain these small things simply to clarify that we are giving a small oxidative stress, not small, because I agree with Angeles, the problem of the oxidative stress is very complicated. So we live. If we don't have stress every day, we can't live. We die. I walk, I have oxidative stress, stress physiological. If I stay also in this way, if I live, if my heart work, if my neurons work, I have a small oxidative stress. So that's the right way to. So in this document, in this declaration, and it is very important, I am very proud that Brazil is the first country where we propose this kind of document. There is all the information that can help all the health professionals working with medical ozone just about the contraindication and any other condition. Also, contraindication, side effects, and supplementation. Also, we summarize below the main conditions must be evaluated before administering medical ozone and mostly related to the treatment. In chapter 7, we draw WFOT evidence-based medicine. And side effects, we have also we cooperate with Angeles. Angeles was very clear to give us a table, complete table, in which we have all the side effects included, or the other possibility warning that can occur using ozone. Sometimes it's very important also to know this, because there are many enemies in the world against ozone. And sometimes if we don't take care about these small things, they attack us, telling ozone is about things because we can have the problem. But the problem is another one. And notes regarding also about supplementation. It is important. Ozone is simply one small oxidative stress. The real medicine is our body. Our body. So sometimes to my patient, I tell you, if you don't feel nothing, it's not my problem, it's your problem. And give a look, veterinary know very well that, for example, for the animals, they are not like us. They sleep in the night, they don't eat too much, they don't go to the cinema, they stay. So the apparatus that check the oxygen, the NRF2, is perfect. And one day in Dubai, one man told me, "Doctor, you need to go in one horse before and after ozone. It's fantastic." So any animals usually respond better than humans. And UCC medicine, we talk in this first document because we had no time to talk about veterinary and dentistry that are very important part that will be done later. And so we talk about these uses, approach to patients, general rules. So some suggestion, because with ozone we need to take care and to inform the patients, because as I told you, you are the medicine, not the doctors. The doctors try to give you something that want a response. So first session, human medicine, injection, general rules. So you can find all the suggestions. So I don't want to show you only. You can find outside, I suppose, the possibility to have a copy via email. Or if you want the original document, you have to pay because we have to pay that you don't have money enough. But you can have also by email, and you have all the information that can help you. So reading really all the document, and you can find all the help that you need in your clinical activity every day. So also it is very important because some problem can occur during treatment. So it's very important a basic life support and the advanced life support if you have can occur sometimes. In my clinic, usually treating 7,000 patients, I never have problem, only some redness or some increase in heart frequency or some pain due to the injection and vagotonic reaction and sometimes after the treatment, but just very small reaction. So we will be indicated any kind of treatment. The doses suggested, I mean, the doses must be decided by you in relation to the response of the patient. I forgot, perhaps it was one of the first slides. It is very important. It's very important, the generator. So when at the beginning I told you we need to inject ozone, we prepare every day during our clinic our medicine. We don't go to the pharmacy to take one ampoule of aspirin or other things. We prepare, so it is very important. We don't have rules. If some people that check your quality, usually they don't know which kind of generator I can use. It is not a question of money. Sure, if I use an Ozone, I can spend 15,000 euro. And if I want another apparatus, I can spend less. It is not a matter of price. It is a problem of quality of the generator and quality and check of the concentration that you have. You are the producer of your medicine. You. So from the beginning, you need to use the best. So the ozone and the mixture oxygen-ozone, obviously, always you had to use medical oxygen. Some people use air. In some place all over the world, I visited a lot of countries, and sometimes I saw this kind of difference. You need to use medical oxygen because it's important that when you inject one gas inside the body of your patient, you are responsible of this. You can't put ozone produced by air. So it is very important, the first step, self-regulation. Okay, also if we don't have any rules that check which kind of machine you have, your kind of generator, we need to know if we love ozone, if we are really happy giving ozone to the people, because we know that we can help these people. We must be the first to be critics in ourselves. We need to pretend by ourselves the best for the people that come in your clinic. And the best does mean also the generator and the knowledge, the indication. I say you, okay, you need 10, 15 micrograms for this kind of treatment. This is because all the people that we heard all over the world, they told me, I use 10, I use 15, I use 17. I put this range. That is the range where we are sure we don't have any side effects. And you need to know also, but you know that the amount of ozone that you inject must be less of the antioxidant capability of the organ where you inject ozone. Does mean that if you put ozone on the blood has very high antioxidant capability. So you can use also high concentration. See, finish. So we put something about extra intra-injection. You can see all this. It is not important that you have notes about this because it's very hard to. Lumbar intraforaminal inject also this with the help of neuroradiologists that gave to us the concentration and the technique to be used. Systemic blood treatment. You see now this new definition. It will be very difficult, but for example, in Italy, some people come to me. The patient come to my clinic, ask me, "Hi, doctor, I want one GAET." One GAET. GAET is Italian acronym that is Grande Autoemoterapia. Grande Autoemoterapia. These problems alerted the transfusion center. The transfusion center start to see what are they doing in this clinic? Grande Autoemoterapia. That means that they take the blood, so we must to be present in that clinic. They went to the minister, so you can't use this if we don't have a transfusion doctor inside your, and you need to pay. That is a stupid things because really we are not doing, we have nothing to see with transfusional center because I don't take the blood completely. So the blood is always in your body. I take 100, 200 milliliters of blood, and with the same needle I put back. This is not a transfusion. This is simply put ozone on the blood and give it back. And this is fundamental to produce the miracle of NRF2. In 2014, we did one experiment. I pay myself. I asked to one friend in Colorado, in Durango, I don't remember the name, and I asked him, could you buy in the United States, because it's less expensive, it's cheaper in respect to Italy, one kit to measure with ELISA the level of NRF2. You can see wonderful activity. So you put ozone and you check the blood before and after ozone, and the level of NRF2. But what I asked to these colleagues, because was 6 students of medicine in the faculty of Ancona, 3 female, 3 men, they stay 1 hour here, and I want to check the level in your total body after 1 hour. The level of NRF2 was high at the same level. It's incredible. That means that the information that we have in 150 milliliters was in all the 5 liters that we have in our body, the information was transferred to all the other. At the level, the NRF2 remained high. So with all the positive effects, Angres told 200, now we know that are 2,000, not me. I saw the last work of Cord, 2,000 genes, but perhaps are more, because if NRF2 is an evolutionary tool, biochemical pathway that we need to live in this planet, because we live for 80, 90, 100 years in this kind of planet, and some God put something that, okay, could help us to live better. And this is the NRF2 pathway that check all. And if there is something that does not go, okay, I don't want to say the same thing as yesterday, but you understood. We are really in front of a big miracle. So, and we described in this paper the methods that actually we use, the glass bottle or the plastic push. There are 2 kinds of treatment. I know that here you can't use the bottle and you use the flash, but the difference is that we use the blood treatment with glass bottle. With glass bottle, if you come 2-3 days in my clinic, you can see that in the morning, just in 4 hours, you can treat about 20 people, 20, and during the day, 40, because it's very simple. If you use the best technique, and if you use the right butterfly, that must be 19 gauge, because the problem that we have when the blood come back, clot, it's a big problem. And now, this is a problem that all we had before, but we try to reduce to the minimum. Systemic rectal treatment, also general rules, and you know that is also in some problems, but also to maintain healthy. So I do myself usually this every 15 days, but I don't pay. So for me, it's free of charge. And the topical application, badging, and you can see, we in this document, and some people told us, how could you arrange 300 references? 300 references was really crazy to put what is this? Every treatment that is described is with the reference that you can see in the bottom of the document. And we added also 1 part related to ozonated oils that we start to know that are very important tools. For example, in the wound, just our friend from Israel is not here, show beautiful data regarding this, using also ozonated oils, but also in dentistry is very important just to reach the best restoration of tissues. And adverse reaction. So in this document there is 1 form that I suggest all you to print and to take in your clinic. And there are some questions, which kind of problem we have. Sometimes could occur that some people have some problem. Okay, you can write. And other question that this will be important all over the world to reach just a data bank to summarize all the possible side effects and also the possibility that they occur or not in which frequency. And the conclusion, the time scale for working in the medical ozone to become aware of the clinical integrative importance of this medical resource. Integrative. Because one of the problems why most of the doctors usually fight with us is that we want to solve all the problems alone. And be sure, I am the first lover of ozone. I love a lot this kind of therapy, but I know what we can do and we know the limits of this. Alone is very difficult to reach the best results. We need to integrate, and ozone could be integrated by all, because we saw that this mechanism and RF2, that many papers now are writing about NRF2 because it will be the future. If you check, if you can understand how could be possible that this relationship with NRF2 and the gene activated to solve a problem, a rare illnesses. For example, I mean the speaking with a VIP person that is in my clinic, and he is 99 years old, and is very important person because he was minister. And he went in the clinic not for Parkinson, but it started to be some, and I told him, if you give me $1 million, I set up a clinical study, randomized study, and I demonstrate that ozone could be helpful in Parkinson. What is the big mistake of doctors? When I teach to my student in the medical faculty, you have a Parkinson. Parkinson does mean the substancia nigra, the neuron that produce dopamine, the gene that produce dopamine, es viejito, pobrecito, tiene 90 años, 80 años, y produce menos. Produce less dopamine because está cansadito. ¿Qué hacemos nosotros? Nosotros, no te preocupes, te doy la dopamina de afuera. Yes, I give you dopamine from outside. And if I am the neuron that is cansado, I work at 45% in respect when I was young, that my level of dopamine was 80, 70%. Now 45. You are giving me dopamine. Bye-bye. Yo me voy. That is, yo me voy is literal, but I can say I use down regulation, apoptosis. Me muero, no sirvo, porque estos pacientes, these patients, they will die worse. Without medicine, we have more hope. But if we give just a small amount of ozone, could be possible, I am sure, but could be possible because I don't have proof that we can increase the oxygen to the tissues, to these neurons, and you can modulate with the NRF2. Oi, Gene, please, wake up. Come back to 50, 55%. We don't know because if we don't have the cooperation neurologist,
Bună ziua, bine,
I would
ce
like
fac?
to do this kind of work.
Mă
One
conversam
neurologist,
cu
before
Lamberto
giving
ăsta și cu
medicine, come to me
Așa,
together because I am not a
mi-a
neurologist.
trimis astea.
You need to help me to help these people, these patients. Okay, before giving this, I give treatment. And after we give treatment with your medicine and only medicine, I am sure about the final result. I am sure 100%. These people increase, will be a well-being, and will die better. So we need to increase the quality of life. It's sure 100%. I told him, but I need $1 million. If you give me, okay, we finish, more or less, we finish. Now, the Sao Paolo document. This is for you. For you, you deserve this because you are beautiful people. And I thank you to be here because only being here and hearing all the professionals like Angeles, Silvia, and all the other people. I want to mention all the speakers because it was fantastic. We can have the information that we need to reach the best results. So I want to thank these people that